we're really starting to see really in-depth research. And the in-depth research does show that consumers can play an active role in their healthcare if they have access to the right information. The key here is to making sure that they have access to the right information in a format that's usable by them and that they're enabled and engaged with the healthcare team to share with it.
Hello and welcome to Pulse, your podcast delving into all things health, innovation, digital and data. Proudly brought to you by Pulse IT News. This is our Hot Topics show and I'm your host, Louise Schaefer.
And I'm your other host, George Margellis.
George, we've had Easter. I know not Greek Easter, but we've had other Easter. Did you do any celebrating at all or you were held off to Greek Easter?
No, I actually took advantage of a nice, long, relaxing weekend, which is good to have. It was good because basically we got a chance to spend 4 days at home and watch some TV and the kids came around. Oh. I took Evie to her very first Easter bonnet parade. That was a lot of fun.
Oh, what did she wear?
Well, Marina spent hours making her a hat. Yeah, poor kid was a little perplexed when we got there with all these other kids with funny hats on their head, but it was good. But look, the interesting thing about that event was that it's actually a local event sponsored by our local pharmacy. There's a big pharmacy here called Walsh's Pharmacy, and every year they run a Easter bonnet parade and they do a Christmas pageant, and it's just like a real community pharmacy. And I reflected back thinking, as pharmacy starts to become more supply chain and AI driven and technology driven, what we would miss by not having this local community pharmacy who gets people together. So I guess it's just a reflection that maybe technology solutions need to think about some of those other things they do. But yeah, other than that, it's been a pretty busy fortnight. We've had a couple of conferences. We had a couple of aged care events. We've had a digital maturity webinar with our good friend, Greg Moran, and that was interesting.
Oh, yeah.
We had another one focusing on AI. And I went to a very interesting event during the last fortnight. It's also been Greek National Independence Day. So it's a big day for the Greek community. There were 4 MPs that came out from Greece and they had a luncheon for them. And it's got me thinking because when I was in Greece and in Europe recently, one of the big topics of discussion was the Horizon grants. They have these really strong research investments in Europe called the Horizon grants, something like €100 billion budget over 3 years. So they're a big deal. And over the last 2 weeks, the head of the European Commission was out here as well. And one of the big announcements there was that Australia is now eligible to take part in these Horizon grants. So this grabbed my attention because I saw some of the research being done in Europe. And what I liked about European research is that it really was equitable research. It was really about how you deliver care to a community, to the whole society. We've seen some of the research come out of other parts of the world, but that are very sort of micro-focused on business models. Because Europe has a very broad national health system like we do, their research was quite exciting. So I thought, here's an opportunity for us to start thinking about how digital health can play a bigger role here. And whilst I'm a big fan of going over to Europe and sitting on the Greek beaches, there's actually a lot of potential benefit here for us to think about stronger alliances between our researchers in Europe.
We can put a link to these Horizon grants in the show notes.
Absolutely. I think we can add value to the health technology sector here in Australia and maybe have some alliances around the world because that's what we're seeing. The world is a funny place.
Yes, and smaller as well.
What have you been up to, Louise?
Not a lot. I had a great Easter break because I sort of ignored Easter. I ended up in Sydney catching up with a girlfriend, and it wasn't until I came back last night at the Qantas Club Lounge and they had hot cross buns and I'm like, oh, it's Easter. Great. And so I indulged in a couple of hot cross buns in the lounge on Monday night. But yeah, so it was really nice. I kept looking at my phone going, oh, no messages, no emails. This is awesome.
Absolutely.
So yeah, slept in and had fun catching up with a friend. And yeah, it was really great.
Yeah.
Greg Moran seems to be making common appearances on our podcast, references to Greg. So hello, Greg, if you're listening. But yeah, Greg and I have just started our ECRI Labs, our next current cohort.
Excellent.
And so, yeah, we've got great people going through this clinician incubator that we're running here in Melbourne. And we've got people coming from all parts of Australia here for that. We've got some dentists, a lot of allied health people this time round. But yeah, so I've just been enjoying some time off and trying to get my sleep debt caught up, George. I'm still not doing great with it, but it's getting a bit better.
If there's anyone who deserves some time off, Louise, I'm pretty sure it's you.
Oh, I don't know about that, but life's short. I'm just trying to fit a lot in. Cool. Well, shall we start our hot topics for this week?
We should.
All right, we're going to be kicking off today's hot topics in Ireland. As reported by Pulse IT, Ireland has just done something most countries have not. They've published a national AI strategy for health. With the title AI for Care 2026 to 2030, this national policy strategy sets out a roadmap for AI adoption across 4 domains: clinical care, operations, research and innovation, and public health. It positions AI as a key enabler of healthcare system transformation with the aim of improving clinical outcomes, operational efficiency, research capability, and population health management. This is a very serious document, and it's about infrastructure, governance, and actually embedding AI into care delivery at a system level. Its tone, I would say, is very much AI needs to be implemented carefully, safely, and with the workforce, not to it. And I really think it's worth looking at because it's a clear signal of what serious national level AI health strategy looks like when many countries, including our own, are still experimenting at the edges, and other countries, I think, would do well to review the Irish strategy and see it as a benchmark for where they themselves are sitting. What do you think about this one, George?
I do have to say that I do love the Irish and their practicality. They do develop solutions that are doable. And I have to give a bit of a shout out here to our good friends at Enterprise Ireland, Judith and Sophie, who have been doing some great work in introducing Irish health tech companies over to Australia. And also a shout out to my friends at the Global Health Connector, which is actually based in Ireland. So Irish innovation is something I've been following for many years. Even when I was back at Intel, our main research lab was actually based in Ireland, and there was some amazing work coming out of there. Having said that, I found the Irish AI strategy a little bit too conservative for my taste at present.
Okay.
I'm not saying it's bad, but it really does err on the side of caution and focuses on a slow and steady approach. And that's in a world where AI is progressing so rapidly. This slow and steady approach just seemed to me to be a bit slower than what it needs to be. It does talk about person-centered health, and it does talk about how we get people involved, but it did predominantly focus on the clinician, and that doesn't really push the boundaries. And as we've had in many discussions on our podcast, AI is moving at such a rapid pace outside the clinical community. Having it tied into just clinicians is probably a bit self-limiting. Now, having said that, keeping in mind, Ireland is part of the European Union and they do have their own AI governance requirements. So it is doing what needs to be done within the confines of those restraints. I've spoken to a number of my Irish colleagues, and Ireland has a number of health challenges just as we do here. The workforce is an issue, money is an issue, aging population is an issue, all those same problems.
And I think their workforce issues are even worse than ours because a lot of their workforce is coming here.
Absolutely. The one comment I had when I met with the Irish health minister a couple of years ago, and the one thing he asked me is, will you stop stealing all our people? It seems that having sunshine is a bonus when it comes to living in a country. So, yeah, we have that advantage. But I think Ireland is a nice, small-sized economy, highly educated people. It has a really strong culture of care and support. Having said that, it picks up on some really good important points. Standardized data, interoperability is key requirements. Maybe we should actually get Spark over there to have a chat to them about how they can do that. And the other thing I have to do is congratulate on the fact that they actually did publish it. So this is not sitting on a back shelf somewhere. This is something that's open for discussion. And what it will do is drive an open discussion, and maybe as it iterates, it'll become better. I think Ireland is a great country for us to ally and link ourselves with. Yes, it's small. Yes, it's a fairly tight economy and has links to Europe that we don't have, but it also has an opportunity for us to think about what we can do that emulates them, and maybe we can have a global AI strategy going forward.
Yeah. I think you're right, George. For yours, my taste, yes, it would be great if it was a little more ambitious, and also recognizing, which we'll be talking about later on in the pod, about consumers' use of AI. But at the same time, at least they published it. Like, most countries are not doing this. They're just like, oh, it's all too hard. It's someone else's job. And they did have some real world examples. There was the example of the Irish University Hospital, and it doubled its clot detection rates by deploying AI across every patient CT scan continuously, and emergency physicians got the results within 2 minutes. There were some real practical things in there, like you said, and maybe we can get, like, I've good friends with Loretta Grogan at HSC, the Health Services Executive. So maybe I'll reach out to Loretta and see if herself or some of her colleagues would like to come on the show and talk about it. because we really want to support the work that they're doing there and use it as a way to amplify what they're doing, but also get other countries, I think, to actually think, yeah, we're dragging our heels. We need to get something down on paper and support our workforces around this.
Yeah, look, when I was in Europe, I met with a couple of the Irish universities, so they're doing some great research there as well. And the other thing, of course, is that they actually have an interesting cross-border challenge. When you talk to the Irish, they tend to think of it as a single entity. So they're actually managing cross-border care as well. I know that Enterprise Ireland has a couple of events. I did go to their St. Patrick's Day luncheon, which was a lot of fun. But I know they will have a presence at Digital Health Festival. So maybe we should have a chat to them about getting some more Irish engagement.
Yeah. Okay, let's do that.
I know Pulse IT is in Ireland, so we really should be thinking about it.
Yeah. All right, George, sounds like a plan. All right, Digital Health Festival, we'll make it happen. All right, on to our next hot topic. Now, anyone with an interest in patient safety will want to look at this one, which is pretty much the entire Pulse Body audience. Now, ECRI is a globally recognized patient safety organization in the US. They've released their 2026 Top 10 Patient Safety Concerns report. And for the first time, navigating what it calls the AI diagnostic dilemma has taken this top spot. So that's AI as the number one patient safety risk for 2026. Not medication errors, not workforce shortages, AI. Now, it's not because AI is inherently not safe. It's because healthcare organizations are deploying it into clinical environments faster than they're building clinical safeguards around it. So regulation, proper evaluation, clinical governance of AI, these things, of course, take time to do and take time to get it right. And ECRI pointed out that AI models are only as reliable as the algorithms that power them and the data on which they're trained, which can include gaps or biases that can worsen health disparities. And George, I was thinking a colleague of ours, Robab, here in Melbourne, she is doing some great work looking at AI evaluation, as well as many academics within the system as well. We really need to do a much better job of evaluating these things, but doing it at scale and quickly, because clinicians want this by and large. Patients are already using it. Like, we don't have time to sit there and take our time with this stuff. What are your thoughts about ECRI's patient safety report?
So the first thing I had to do is look up what ECRI was, because I've heard of them, but I didn't quite know what it stood for. So when I looked it up, and it did take a little bit of research to find what it stands for. It's the Emergency Care Research Institute. And its history actually goes back to the 1960s, when its founder experienced a defibrillator malfunction that cost the life of a 4-year-old patient. And as a result of that, he started looking at patient safety. Again, something driven from a clinician who saw a problem and formed ECRI to look into it. Look, the fact that it named AI as the number one patient safety concern amongst its top 10, and the top 10 does include some very interesting challenges, is concerning. To be more precise, and as you highlighted, it's not AI per se, it's navigating the AI diagnostic dilemma. What does that mean? Basically, how do we use AI within our workflows to diagnose conditions that we can then manage treatments for. And it does highlight a number of the challenges: automation bias, de-skilling, lack of transparency, all issues that we've discussed in the past. And it calls for what they call a balanced approach. They say clinicians, and I'm quoting them directly here, clinicians must view it as a tool designed to supplement and support clinical expertise, not replace it. And it makes some very good recommendations around establishing AI usage policies, proper disclosure, and proper training. However, a bit like our Irish friends, it does ignore that the technology is openly available and it's being used by consumers and clinicians around the world without a lot of supervision. So the reality is that as consumers are using it, and even as clinicians are using it, we need to really start thinking about how we capture those usages models and make sure that they've got a safety mindset built around them. Now, one of the big things that happened after the release of the Tueri's Human Report back in the late 1990s was that clinicians started talking about safety. We started thinking about this story of 2 jumbo jets a day crashing due to medical error and focusing on removing those sources of error. So this is where the education component comes really critical. We need to have the clinicians thinking about it, but we also need to have consumers thinking about it. And we need to think, what can the AI tool developers do? Because they're ultimately the ones who are putting these tools in the hands of people without these guardrails and without these restraints. How do we get them actively engaged in understanding the risks associated with technologies like AI and how we assess it? To your point, evidence-based information around safety issues, I think, is critical. evidence-based discussions around the effectiveness and efficiencies are critical. I think we need to have a lot more research. And does that mean we need to slow down a bit, or at least make sure we put some guardrails in place? That may be why the Irish have got that slow and steady approach. We have to also take into account that people are going to do it anyway. So how do we make sure what they're doing is safe now, rather than sort of try and give them a 5-year strategy on how to become safe?
Yeah. And I noted like that automation bias. So when an AI diagnostic system suggests a specific triage route or highlights a particular problem, the human clinician, and that's been well researched, is psychologically primed to agree with the machine. And we've talked about that before on the pod. Yep. So that's not a technology problem. That's actually a human factors problem, which is something that health informaticians specialize in. So we need more informaticians, more clinical informaticians trained up on this AI stuff so they can get involved and put some really good clinical governance around this.
Absolutely. And look, the reality is often the thing that AI gives you is correct. So, the challenge is, how do you pick up those times when it's wrong? It's not necessarily a hallucination. Sometimes it's relating to the fact that you've asked the question wrongly. So when we look at some of these diagnostic dilemmas with AI, it's how you give it the information. One of the values clinicians add in this whole equation is capturing information from a patient and putting it in a format that the AI can use to analyze the answer. If you miss the fact that someone has a fever, or you miss the fact that they have pain incited by specific movements, the AI can only make a decision based on the information you give it. So errors of omission are probably as critical here as the error making by the solution. We need to start thinking about what is the interface for providing that information to the AI tool. We've seen when we've done analysis of AI's diagnostic capabilities, they take things like New England Journal of Medicine clinical vignettes, captured data sets around how a patient presents. In the real world, patients don't come and tell you, I have left iliac fossa pain incited by movement and a fever of 38.3 for 40 to 48 hours. They just tell you, I don't feel well.
Yeah, this hurts, that sort of thing. Yeah, no, that's right. So we've got to do better on this regard. This report I thought was really worth noting, and not just because AI made its number one, but the rest of the top 10 was, I thought, really worthwhile noting. And they're the sort of issues that are going to be systemic in a lot of health systems around the world, not just the US. Things like reduced access to rural healthcare. That was number 2. Increasing rates of preventable acute disease. Federal funding cuts. So I thought that was interesting, that the economic policy positions in the US that came into play in this report, and inadequate pain management for women. Like, these systemic pressures on healthcare systems are really alarming. And it's interesting to read in the report that they are looking at those big economic levers and the judgments that are being made by government for how funding is being cut, not just for service delivery, but for research as well.
No, look, it was a really well presented report. I downloaded it. I've had a good read of it. Like you said, there are a number of other issues that we need to take into account. Another thing they call out, of course, is that culture of blame. The fact that we have this issue where safety issues become a blame concern, so therefore people don't report them in fear if it's going to affect career progression or their situation.
Yes, absolutely.
Now, we've had some great people here, Bill Runciman, Bruce Barraclough, Cliff Young. These are some of the older clinicians who basically have then tried to change that culture. So it is still a concern because the hierarchy is there, and the capacity for a junior clinician to play these roles. But again, this is where the tools come in place. If the IT picks up that someone hasn't washed their hands and reports it, then you don't have to point the finger at anyone. It's like, hey, the IT says
it. Yeah. Just like when you're watching tennis matches or football or any sport what you're into, and they have the line call, it's just too hard for the human.
Yep.
So you've got the AI playback and measurement to know where that ball landed, that sort of stuff. But those sorts of technologies could easily be deployed in healthcare.
Absolutely.
To actually look for these patient safety issues.
Yep. No, definitely. But like I said, a very good report. The fact that AI is even noted suggests that they're actually looking at these issues in detail. These are the sort of reports that the technology sector needs to take more notice of, because we've got lots of reports showing how agentic AI saves us 30 seconds a day or whatever. But these are the quality and safety issues that really drive trust in this industry.
Yeah, so important. Oh, thanks, George. Now, on to our next hot topic. We've talked before on the pod about the fact that there are literally hundreds of thousands of apps in the app stores claiming to be helpful for your health, wellness, chronic disease management, etc. But the app stores don't require any evidence of clinical utility. You just say it does this and they believe you, and you put it in the app store. They just don't care. And of course, the nicest thing you could say about it is that it creates a complete mess for consumers and clinicians to navigate and work out whether this app will actually be helpful or not. Well, now Apple has finally made a move that will have significant implications for every health and wellness app developer in the App Store. Apple now requires developers distributing health apps in Europe, the UK, and the United States, hopefully other countries to follow. Now they have to declare whether their app is a regulated medical device. For new apps, the requirement is immediate. For existing apps, the deadline is early 2027, and developers who fail to declare their status by then will no longer be able to submit app updates. George, do you think this Apple mandate is going to do more to shift industry behaviour than maybe other regulatory guidance alone?
The launch of the Apple iPhone going back, 20 years now, is definitely a game changer in the sector. And yeah, we've seen the app stores come in with thousands, if not tens of thousands of health apps with very little governance around them. So the fact that Apple's getting actively engaged here, I think is a positive. To Apple's defense, this is hard work. It would have been a lot easier for them to say, hey, the App Store is just a platform. We take no responsibility, all care taken, no responsibility accepted. But the fact that they're now saying that health apps need to decide whether they have to be a regulated medical device and publicize that is pretty important. Apple hasn't always been known for their transparency in the past. They've tended to be a bit of a black box. So the fact that they're making things a lot more visible and transparent, I think is a good thing. So the big issue is now, what are we talking about when we talk about software as a medical device? It's a pretty complicated concept. If the software involved in an application is in any way involved in the delivery of healthcare, be that through diagnosis, monitoring, treatment, or prevention, it has to meet some fairly stringent requirements around registration with things like the FDA, TGA, or the EMA. These are the regulatory authorities. And for a software developer, that adds quite a large overhead. It's not easy getting regulatory approval for these devices. It does require them to submit a whole bunch of extra paperwork. And from a software developer's perspective, they have to think about whether this is a benefit or a liability, because it's going to cost them extra money. It's going to slow down the thing. But at the same time, it actually gives their device or their software solution an increased trust. I remember years ago, the health applications used to come out and say, these are purely for educational and entertainment purposes. These aren't medical devices. The regulators are clamping down on that now. And I think Apple's taken that first step to make sure that those are on the App Store, because it reflects back on Apple.
It does. And that's what I was thinking. I wondered whether at Apple HQ, one of the reasons, like why now? Why are they doing this now? Because they're turning themselves into a compliance gatekeeper, not just a distributor. And before, they've always just been a distributor. It's our platform, put whatever you want on there. And I think this raises a real question about who's responsible when an app gives bad advice. Is it the developer? Is it Apple or the regulator? And I think Apple's trying to say it's not us, because we have, that we've had to check and they're apparently compliant by whatever federal agency is required in that country to regulate software as a medical device. But given the court cases that Meta has lost, which yay, thank God they lost that case, these apps and platforms are now going to hopefully start to actually take accountability and responsibility for people having adverse outcomes from the use of products that they effectively serve up to consumers. So I'm wondering whether this was something that Apple saw in the making and thought, maybe we should get onto this, and wouldn't it, it's much easier for us rather than us getting sued one day. Maybe we just say that you just have to prove that you're compliant, and as long as you show us that proof, then we'll let you on the stall, and we'll note that anything that's not compliant will be noted as well.
To me, that's a positive thing, because like you said, we've seen lots of examples where the platforms just step back and go, hey, we're just a platform for distribution. We no responsibility taken. And we've seen some of the outcomes have been fairly horrific. And in healthcare, let's be honest, some of these apps couldn't cause harm by at least making them certify that whether they're a software as a medical device, which would then also need to train the public to look for those devices or those software services that are regulated, because they know they've gone through a quality assurance perspective and there's a feedback loop to correct any challenges going forward. So from Apple's perspective, and hopefully Android will follow suit in the future, it's really good that we're doing that. We also then need to have some more discussions around what software as a medical device means. And then this comes back down to both health literacy and digital literacy of the populations. Yeah. As more and more of these tools are being used, people need to understand the implications of using these tools. And regulation, whilst sometimes we complain about how onerous it is there to save people's lives. The FDA was formed because there was evidence that unregulated medicines were causing harm. These requirements are in place for a reason. They're not just there as a way of hampering innovation. They're designed to literally save lives.
Yeah, no, it's a good thing. All right. Thanks, Apple. We will keep an eye on the potential outcomes of this decision that they've made. Well, time for a quick break. And when we return, we're going to be talking about some new studies looking at consumer use of AI and huge news out of the NHS regarding the digital health workforce. Back soon. Now, a constant theme of our show is how patients deserve access to their own health information and how they are using AI. There's been some interesting research published on this topic recently. So some of these are a US charity organisation, the KFF, released a tracking poll on health information and trust, which focused on consumers' use of AI for health information and advice. The poll shows that a meaningful proportion of US consumers are already using AI tools like ChatGPT Health to look up health information and advice. We're talking 1 in 3 adults. That's equaling the share who use social media for health. Now, this signals a real behavioural shift and is particularly true for those who lack regular access to a healthcare provider. And importantly, many are doing this before they see a doctor, as George and I have previously discussed. Another study, the Essence study, was published in the New England Journal of Medicine AI. And that study measured actual behaviour, i.e., what patients did with AI, not what they said they intended to do, but actually what they did when using the AI symptom assessment tool integrated into Portugal's largest private health network. Now, among the findings were big improvements in appropriate care use, an increase in primary care consultations, less specialist visits, and less ED visits. This is a really important study because it shows AI changes the cognitive frame of the patient and can change actual behaviour, not just intentions or not just knowledge, but actual behaviour. We need a lot more research on that. And finally, friends of the pod, Sarah Regar and Charlotte Blees, were co-authors in a Lancet Primary Care piece last week that calls for healthcare systems to actively respond, not by trying to stop patients using AI, because clearly that's not going to work, but by guiding its safe, effective and equitable use within care pathways. Now, George and I are going to continue to bring you stories like these on the pod, and I know I give a lot of keynotes and run workshops on these topics because healthcare systems need to engage with this reality and move quickly to support their workforce, to support their patients. Because whether we like it or not, AI is already in the consultation room. It just doesn't have a Medicare number yet. George, the evidence base is building here.
One of our favourite topics, consumer use of AI and digital health, has been getting a lot more airplay recently, as you noted. I probably have mentioned this because I'm really quite proud of it, but the very first presentation I did at a HISA HIC conference was in 2004, where I ran a half-day workshop on consumer informatics. This is not a new idea. Back in 2005, I did a presentation on the personal health record as a disruptive innovation. Health technology or digital health in consumers has been a topic of discussion for a while. AI has just taken to a whole new level. And I think it's really exciting that we're having these discussions on the podcast. We've had Charlotte Blees, we've had Sarah Regar on the podcast. We've had the grandfather, I guess, of consumer engagement in healthcare is ePatient Dave. We've had him on. We've had Danny Sands. What's really exciting now is that we're actually now starting to look at this with a lot more academic rigor. So in the past, we've had a lot of anecdotal stories of how it's used, and we've had some sort of light touch stories. But now serious universities are starting to do serious study in this space. In that same edition of Lancet Primary Care, there was an article written by our good friend, Professor Michael Kidd, who's now Australia's Chief Medical Officer. Michael was a professor of general practice when I was at Sydney University. And we're really starting to see really in-depth research. And the in-depth research does show that consumers can play an active role in their healthcare if they have access to the right information. The key here is to making sure that they have access to the right information in a format that's usable by them and that they are enabled and engaged with the healthcare team to share with it. I think consumer AI is going to be the game changer. I'm a big fan of Clayton Christensen's work on disruptive innovation. I read his books back in the early 2000s. I actually got to see him once present at Harvard at a conference. The guy was about 6'7" and is quite a imposing figure. But he talked about how disruptive innovation happens. And at the moment, we still keep focusing very much on the concept of the human in the loop. Basically, tying AI's arms down by making sure that the human has to tick off everything. But what we are seeing more and more is that the human's role is starting to shrink. And while we have seen a couple of quite spectacular commercial failures when they've tried to do this in the past, people like Babylon Forward and some of the Amazon ventures, we are seeing progress. We are seeing more AI as a front door type coming into healthcare. And I've recently been reading Robert Wachter's new book, and he talks very much around the changing business models of healthcare and how AI will play a role. So if you think about the Christensen philosophy, when you first start doing this, you start off with something which is subpar. It's not as good as the existing solutions, but it's cheaper and it's more available. But it rapidly progresses. And I think that's what we're starting to see with AI in the consumer space. We really need to start thinking then about, okay, where can it go to? And with the rapid evolution of AI tools, this is not going to happen in decades. So we used to talk about innovation taking 18 years in healthcare, but these innovations are taking 18 hours to come into play. Remember when ChatGPT was launched and within 24 hours, everybody we knew had downloaded it and was using it. So these are the sort of things we need to think about.
Yep.
And I think these articles are doing a great job in demonstrating that its usage is increasing. Then we have the ECRI report, which demonstrates the safety risks associated with them. And putting all those pieces together, I think, is really critical. Back in 2016, Eric Topol published The Patient Will See You Now. That world is coming to exist where the patient is playing a much more active role. And I think we really need to be on board with it. AI in 5 years' time will play a very significant role in the way we deliver healthcare, whether it is totally autonomous or not. I'm not quite sure whether we'll be there yet, but it will play a greater and greater role. We need to prepare for that. And the best way to prepare for it is for these researchers to play an active role and publish about it. The fact that we actually have publications like New England Journal AI and Lancet Primary Care publishing these papers is fantastic. Listen to our podcast, keep engaged, and I think this is going to be the hot topic over the next 12 months.
It really will be, absolutely. And there's so much work that needs to happen in the research space, but also looking at health literacy, regulatory frameworks, and of course, the digital health workforce. I spoke at a conference a couple of weeks ago. There was a lot of clinicians and healthcare executives in this audience, a few hundred people there, I'd say. And I was like, this is what's going to happen. This year, you are going to hear stories from your clinicians of people rocking up, asking for their digital download of their record, not just armed with more information, and some of it's going to be wrong information, but they'll actually expect you will give them a full copy of their record. Do any of you having these discussions? Do you have a plan? And I could see the audience collectively like mouths agape, like they hadn't thought about it. And I was like, okay, there's one thing that if you take away, you need to start having these conversations. I said, listen to George and I on the pod. We talk about this stuff all the time, but also you need to make it at your board meetings, executive meetings, departmental meetings, management meetings. Start talking about this stuff and what you're going to do about it, because in 12 months' time, it's going to be old news. And if you haven't got plans in place, it's just going to add even more pressure on an already stretched workforce.
Look, the concept of a personal health record of people holding onto their own information is not new. We've had the blue button, we've had lots of all those sort of things happening. But the reality is now that in this hyper-connected world, there is no excuse for us not being able to provide that information in a standardized format. We've seen health record standards come out. We've seen the personal record stuff that came out of the International Patient Record Collaborative. There's lots of opportunities there for us to do it. Somewhere along the line, there will be a tipping point. Yeah, I was probably very optimistic in 2004 when I thought the tipping point was there, but 20 years later...
You're just visionary, George, visionary.
Yeah. The problem with visionaries is that you watch it come past and they're going, okay, that sounds like a good idea. But yeah, look...
No, you're just ahead of your time.
But the opportunity to deliver on it is now, and I think this is a real opportunity for us to play that role. And the fact that there are Australian universities involved in this research as well as global organizations, and that publications like The Lancet, who 20 years ago would never publish an article about AI. Let's be honest, that we had to get the Journal of Medical Internet Research in place because no one would publish these things in the normal press.
Yeah.
Now we have Nature Digital Medicine. Nature, which is like the most respected scientific journal in the world, has a digital medicine edition. So this is real progress.
Yeah, it is very much so. All right, now our final story. I am personally just super excited about this one. The NHS is formally recognising, yay, its digital data and technology workforce as a professional group. Now, many listeners to Pulse would understand that while this might not sound headline grabbing, it's super important because in healthcare, professional status is everything. It shapes identity, authority, career pathways, and influence. And for years, the people building and running digital health systems have sat just outside that professional recognition status. So I just wanted to say thank you and congratulations to the many people behind making this happen. You all had to play the long game and now it's here. There were many people involved, but I wanted to give a big shout out to the Federation for Informatics Professionals CEO, Andrew Griffiths, based in Wales. He and I have spent countless hours over, I'd say, the last decade talking through how to make this happen. I was actually at the launch of the Federation for Informatics Professionals a long time ago, and it's here now. There's been setbacks along the way, but now NHS England has an expectation that digital data and technology staff will be professionally recognised because they know that these roles are as critical to patient outcomes as clinical care itself. George, this is a good thing for the workforce, isn't it?
Absolutely. Look, I know this has been one of your passion projects for years. So going back to the CXIO network, introduction of cheers in Australia. The fact is that anything that demonstrates professionalization of the workforce in this space is a positive thing. One of the reasons I had to leave clinical space many years ago was because there was no professional career plan for people like me who are interested in space. So we now have CMIOs and whatever in our healthcare system. But again, we only have them at a very senior level. We don't have a career progression path. So professionalization is critical for young professionals developing their career plan, working out where they're going to go, where they need to spend more time in their study, what sort of networks they need to develop. And one of the key benefits, of course, of this is things like continuing professional development, having structured educational programs which progress their pathway. One of the challenges we've had with CPD in this space in Australia up to now has been that we've had to piece together bits and pieces to build our own professional development plans. And it's not easy finding the right education places to go to. And often it's been very expensive to find the right education to go to. I went over and did a graduate certificate in health informatics at Harvard. That was an expensive exercise out of my own pocket. It was great. I got a lot out of it. But I had to be in a position to be able to do that. I was fortunate that I was. Yeah. A lot of people aren't. But actually having this professionalization, I think, is important. And again, the CHIA certification in Australia was a great start. I still think we haven't quite got the end-to-end solution. One of the important things, of course, is that I note that the NHS is sponsoring this. So they're actually providing reasonable price points for people to be able to have these qualifications. Because let's be honest, some of these professional organizations we join over our careers can be pretty pricey. I just paid my Australian Institute of Digital Health subscription. And it was pretty expensive for a year. And many people would be scratching their heads about, do I spend that money? But the fact that the NHS has recognised that this is an important part of the process and therefore are helping people pay
subsidising
it, I think it's really good. So I think it's fantastic that we're seeing this happen. The NHS has done lots of great things in the past. They do it in times of tight financial restraints. And I think we should be watching this with great interest.
Yeah, no, it's excellent news. So good. And yes, we will give updates as that progresses. And hopefully other countries are inspired by the efforts of these people in the NHS. And I know I'm doing work on workforce digital skills uplift in Wales at the moment. So my next meeting, I'll be asking them about, hey, what do you think about this? Is there any chance? What can we do to make it happen in Wales as well? No, this is great news. Really good news story to wrap up today's hot topics, I think, George.
Yeah, definitely. Look, I fully support it, and hopefully Australia can be part of that. Again, there's no reason why this can't be a global initiative. This doesn't have to be just a local initiative. This is, and I know that you've had discussions with groups around the world. Translating it into Welsh may be a bit more complicated.
I do find that I'm like, oh my God, there's so many consonants. I'm not even sure where to start. So I don't even try. I'm hopeless. Cool. All right, George, just to close out the show, do you have any recommendations for the Pulse Potties this week?
I am preparing for ITAC coming up in May in Brisbane, and I think you'll be joining me this year, Louise. And so
I'm looking forward to that.
Anyone involved in aged care technology or aged care services or just delivering services to older Australians should consider attending. A couple of weeks afterwards, we're going to be at Digital Health Festival. I know that's going to be another big event. I have been reading Robert Wachter's book. So Robert Wachter wrote The Digital Doctor back in 2015. His new book is much more focused on AI. It's well-referenced, interesting reading. And it's interesting that some of the oldies in the game, so Robert Wachter's older than me and Eric Topol's older than me, and these guys are still playing an active role in this space and suggesting that this is the way forward. Keep your eyes out for sort of those publications. But yeah, if you're in Brisbane in May, come and say hello at ITAC. If you're in Melbourne at the end of May, come and say hello in Melbourne. In between, I'll probably be in Sydney. Come and say hello to me in Sydney.
Oh, okay, will do.
What about you, Louise? Any recommendations?
No, not this week, really. Although I would say I know sometimes we give TV show recommendations, and The Pit is almost finished, and I'm really looking forward to it because I've been denying myself the gratification of watching The Pit until it was all done so that I can just binge watch it over the course of a couple of days. I'll be doing that, I think, over the course of the next coming weeks. Some of it just sitting on the couch, lazing around, having a bath, watching it. Other times I will be on the treadmill because it's 15 hours of TV, so I can't just sit still the whole time. But I'm looking forward to it.
Funny you mentioned, we did binge watch a show over the long weekend called Dr. Odyssey. Dr. Odyssey is a combination of House, the Doctor Show, and Love Boat. It's an interesting progress. So from a medical perspective, it actually had some really interesting medical stuff in it, but it was on a luxury liner with all the implications and connotations of the Love Boat. It was, interestingly, it was cancelled after one series, so it probably wasn't a great success, but it did make for some light watching that also gave you some medical education. And from a medical perspective, it was actually quite accurate. It portrayed a number of very interesting medical conditions. Dr. Odyssey, if you want something light and yet medically educational, I can recommend it, but maybe the only one because it was cancelled after its first series.
I loved how you described the show, George. So I'll have to put that on my list of things to watch as well. And did you like the cartoon that AI did of you on the bridge of the Star Trek Enterprise?
I did share that with my family, and they all had quite a big smile on their face when they saw it. And at the moment, we've been watching the Artemis mission to the moon, so the space is back in vogue. So cool. It's maybe we'll start seeing some new innovations come out of the new space program that we'll be able to leverage in healthcare as well.
Oh, that's so good. All right, George, until we catch up again, if you could please read us out.
Thank you all for listening to Pulse, brought to you by Pulse IT News. Pulse is produced by Ivan Jurek of Octopod Productions, and a special thanks to Emily Mara for her support. Big thanks to everyone for listening. Make sure you subscribe, follow, and rate us wherever you get your podcasts. Visit pulseit.news to catch up on the news from Australia, New Zealand, and Ireland, and send any feedback or topic suggestions to pulsepod@pulseit.news. We'd love to hear what's on your mind. Thanks, everyone.